Hi, this is Dr. Jim Hoven of Ramos Law and your host for Health Matters. Today, it's all about the breakdown of spine, muscle, joint, known as degeneration. You gotta know what it is, especially if you've been under trauma. Degeneration. You may have heard of it, but you may not know what it is. Degeneration is also known in common terms as arthritis. Now the term arthritis, if we break it down, means two things. One is arthur, joint. Two is itis, inflammation. So arthritis is inflammation of a joint. And there's several types of degeneration. You may have heard, or arthritis. You may have heard of osteoarthritis. You may have heard of rheumatoid arthritis. So it breaks down, and there's lots and lots of categories of this. Today, we're going to focus on the degeneration that takes place that's called osteoarthritis, and that's the most common kind, and it's the kind that results from wear and tear on your body. Now, before we go into it, it's important to know that there are two types of trauma. One is macro trauma. So if you've been involved in a sports injury, a work accident, a car crash, slip and fall on a ski slope, anything like that, that's considered a macro trauma. Then there's micro trauma. Micro trauma is the thing that we do every day that we might not even realize. It's like poor posture, the way we sit, the way we stand, the way we lift things. All of those things done repetitively over and over and over again can result in degeneration or arthritis. So again, remember, arthritis and degeneration, they're the same thing, okay? Now, I've picked up this spinal model. These are two bones from the spine in the low back called lumbar vertebra. And I want to show you a little bit how arthritis works in the spine. In the case of this vertebra, we're looking at it from the front. This is the top bone, it would be in the lumbar spine, and here's the bone beneath it. Between these is a disc. One of the first places we'll see degeneration or arthritis is in this disc area here. So if we were to look at this, normally it should be the same width, nice and full all the way around it. But let's just say that this spine is tilted to this side. It's pinching down on that side, and it's been like that for a long time. Because this is a soft tissue, it's not made of bone, it's going to start wearing down. Think of a snowball. The more pressure you put on one side of a snowball, when you pack it down, it starts taking that shape, right? But if we ended up taking the snow in like a cake and we put more pressure on one side, it's going to wear down, it's going to degenerate. So that's degeneration of the disc. Now, not only can that happen at the disc, but it can happen back here at the joints of the spine as well. And where these joints, these are called facet joints, and where they come together, that's what allows us to bend and move and turn, because these joints give us the effect of mobility. Well, if these joints undergo trauma, or let's say I carry my head like this all the time, the joints on this side are going to get more wear and tear, more compression, so they're going to break down sooner. In other words, degenerating or getting osteoarthritis. Now, the reason this becomes so important, especially after trauma, is let's just say that you're in your 40s. And let's say you've lived an average life like most of us, where you were involved in some sports, maybe you had a car accident as a kid, you have a job where you sit a bunch, so you're putting a lot of postural stress on, and you eat a lot of inflammatory foods like sugars and carbohydrates, that kind of stuff. You already have an underlying degeneration effect going on in your body, I can promise you. It might be even only a little, but you're going to have some. So now you get into a car crash or you get into a sports injury. And what happens then is it accelerates the degenerative process. So if this same spine that is already just a little bit degenerated undergoes a trauma, if it gets whacked, then it's completely speeding up the process, and that's going to make for a bad day. It's going to make this whole cycle ramp up, causing increased amounts of pain, decreased amounts of mobility, increased amounts of symptoms like radiation of tingling and numbness into arms and legs, depending on where the degeneration happens. So the one thing about degeneration is it can happen locally, but it can go into other parts of the body if it's affecting the nerves. Just like this. If we have a nerve coming out from this hole, and the space gets smaller, it can squish that nerve, causing those types of symptoms. So if you've been involved in an accident, get checked out to see if you have any arthritis or degeneration. If you do, we need to stretch, we need to work out those muscles, we need to get appropriate care to make sure that that's not a long-lasting issue for you. So hopefully that helps you know more about degeneration. We'll see you in the next episode.